So what would you find in this security plan? Well, here's a little bit of idea of things you need to have a security officer. Now, this doesn't need to be an expert on security. What this needs to be is somebody who is a good manager, who can understand what's happening with security. But really, if you have a lot of the your smaller practices, you don't have an expert for IT who really understands security, but you need to have somebody on staff who will be able to keep track of what's going on. So you really need to make sure you have a security officer who's on staff, and this shouldn't be an assistant. This should be somebody who's higher up in the hierarchy, because they're going to need to have the ability to sanction and change things. Now, you need to conduct a risk assessment, and we talked about that in the privacy plan. It's very important in the security plan, because you're going to be looking at things like saying, okay, this is how we encrypt emails. This is how we're taking care of any kind of electronic data. So it's very, very important that you conduct a very thorough risk assessment. And then you need to establish these policies and procedures. And this is your written plan on how everything's going to work. And as part of that, you need to have a backup plan. It's required by HIPAA, the HIPAA security rule, to have a backup plan. And you have to have a disaster recovery plan. How are you going to function if there's a tornado, an earthquake, a flood? How are you going to get that information and make sure that information is maintained? Is that stored in the cloud? Is it stored? Do you have it stored off-site? How are you taking care of that information, and how do you recover that? And another important thing, and we run into a lot of times, is determining access levels. And this is, your receptionist doesn't need the same access that a doctor needs or that a nurse needs. And you need to make sure that you've documented what those levels of access are, and that everybody knows, so that if there's something that looks weird and you're saying, why was somebody in the front desk looking at somebody's health record when they weren't authorized to look at that, or beyond just simple registration, it really depends on how you delineate tasks within your company, within your practice.